today we are going to be talking about ICH GCP E6R2 and implementing risk management approaches for compliance. So let me tell you just a teeny bit about me. I'm not going to go through all these bullet points, but I've been in healthcare for quite a while, and I'm a nurse, and I started out in research from nursing as a coordinator and ran first the pulmonary unit and then a rather large cardiovascular research unit. And I've just kind of come up through the ranks as a CRA, as an auditor, and I have quite a bit of experience in risk-based quality management. And I've been training for Barnett probably maybe almost 4 years now, and have been training just in general for a lot of years. So this is one of my passions, risk-based quality management. I still work as a CRA. I do some work as a manager, and I do a lot of work with individual sites on risk-based quality management or individual companies. So it's truly a passion of mine, and I have boots on the ground, so to speak. I definitely get my hands dirty with all of this. So feel free to ask me any questions that you have. And if I don't know the answers, I will go to someone that does. Okay, so today we're going to review our learning objectives, and then I'm going to ask a little bit about you guys, what you do. And then we'll find out where each of you are with your impact assessment on the changes that are related to ICH GCP E6. We will review section 5 of the ICH GCP E6R2 and talk about implementation approaches and areas that you should look at within your organization. And we will talk about effective implementation and some lessons learned, and then we will have a summary. And as I mentioned earlier, you can ask questions throughout. So for our learning objectives, after reviewing this course and going through this course, you should be able to define a three-way risk evaluation methodology. You should be able to distinguish between the concepts of risk mitigation and risk acceptance. You should understand the concept of predefined tolerance limits. You should be able to describe centralized or statistical, if you will, monitoring. And you should be able to define some best practice implementations based on practical experience. So this particular slide is a high-level review based on what are likely your current approaches or your use of risk-based approaches to clinical trials. So for example, when you look at your glossary, if you have a glossary within your organization, you're going to want to make sure that you have lined up the terminology for the new definitions in ICH GCP E6. Also, that your procedural documents show the changes. And that goes all the way through, starting with your glossary, any principles, procedural documents such as your SOPs, working instructions, whatever you guys call them, any risk management plans that you have in place, any team members, your risk management framework. For example, you're going to want to look at your risk-based quality management plan that you have within your organization, and you're going to want to make sure that if you have not, that you build out or you update your infrastructure to meet the requirements. You're going to want to look and see if you have a metrics program and if it needs to be updated. I want you to also, I put this down here just as a reminder to think about budget and financing impact analysis and reforecasting trial costs, particularly as you adopt an adaptive approach to your monitoring. You'll need to look at your job functions and make sure that you have definitions. If you add in central monitors or other job roles such as risk managers, that you have job descriptions for those, that you explain the roles, the responsibilities. You might want to consider having RACI matrix and updating those if you don't have those. And then, of course, resource allocation, change management. My personal opinion about change management and incorporating all of this is that the directives need to come from your management, and that if you don't have buy-in for all of this at the top, it makes it very difficult within your functional groups and within your organization to make the changes and make them successful. You want to look at your business practices, and also you want to look at the philosophy of your organization and the culture of your organization. Study timelines, Gantt charts are also things that you might want to take a look at.